With Carl's prompting and assistance, I want to go ahead and start the meeting now. And I'd like to start the meeting with a four-way test. All Rotarians of the things we think, say, or do. First,
Is it the truth?
second,
Is it fair to all concerned?
Third, will it build
Goodwill and better friendships.
And fourth, will it be
Beneficial to all concerned.
I'd like to welcome everybody to our meeting today. We've got a couple of visitors. It's nice to see. Carlo Campagna is joining us today as a potential member. He's joining our meeting via Zoom. And Carlo, welcome. We're glad to have you with us today. And we have Lane, our assistant governor, who's representing the governor, attending our meeting today. Lane, welcome.
Good to be with you.
And Leo, welcome to your first Zoom meeting with the club. Good to see you.
Woo! Good to see all you guys.
Not responding.
And I don't see our supervisor here. We'll meet again in a few minutes. I'm looking to see if we have any other guests that I need to recognize. Okay, seeing none, we'll move right into the program, and we're going to do our first scholarship of the quarter via Zoom. So, Tim, I'm going to turn it over to you now.
All right, so how's everybody doing today? Oh, it's a little bit different. I want to thank the Rotary Club for continuing to do the good work that you guys are doing despite the circumstances. And so we're honored today to recognize Danny Manzo as just another just fine young man, just gentle-hearted kid who's worked very, very hard to graduate. He is done with his 230 credits, but he, in the fall semester alone, Danny worked hard. He earned 51 credits and getting a 3.83 GPA in the just the first semester alone, because the guy was grinding it out, getting it done. Had almost perfect attendance. I think he was out one day before all the pandemic started. So just a guy that's very dedicated, very loyal, just gets the job done. All of his teachers just rave about him. And so I'd like to turn it over to Danny. So Danny, maybe you can share with the group, some cues and what your plans are after high school.
All right. Thank you, Mr. Odie. I want to thank the Rotary Club for the opportunity that they're giving me here. I want to thank my mom for always pushing me and making sure that I'm always on track. And my long-term goal, I'd say, is to go to IVC and pursue a bachelor's degree in digital media. I feel like digital media is the right choice for me because I feel like I can make a difference and an impact with my voice and how I act towards others.
And hello?
Hello, we're still going?
Hello?
Yep.
Okay.
So, Danny, are you, have you signed up for IVC already with Ms.
Yeah,
Barcello? I have. Okay, and did you take the IVC class out of curiosity?
Yes, I did. I did take it.
Maybe tell the group briefly about that class. So Danny already is a college student, so just, 30 seconds or less, tell them about the class.
So we took a counseling class, right? And it just taught us how to stay scheduled and on track. It's like, because the main thing that we mess up, right, and we end up going to Hillview is because, like, we either don't want to do our work or we suck at keeping track of our work. And so for me, I did both, but mainly I just, like, never was good at keeping track of my work. So I thought going to the IVC class, it just, like, taught you how to keep track, how to stay mentally okay for whenever you had work to do. And it was just overall a really good class.
So he high school credit, he also got credit. So it's pretty cool. He, signed up for IVC and he's moving in the right direction. So we're super proud of Danny for that.
Well, congratulations, Danny, and congratulations on being our student of the quarter. and the best of luck to you in the future. You've got a bright future ahead of you, and you're on the right track. Thanks for being with us today. Jim, thank you so much for bringing another outstanding student to the club to share with us and for us to share with that student. We appreciate it, and we want to keep up that relationship. Thank you.
We appreciate that. Yep.
Okay, we're going to move on the program now to our supervisor. And Jonathan, would you like to introduce our speaker?
I would. I'll give you a very, Don, I'm going to give a brief introduction because we certainly want to hear more from you than from me, but just so everyone.
Hey, Jonathan, I'm going to let Danny,
Yes.
Danny, you can go ahead and sign off, Danny. And I haven't seen your exit interview, so I'm going to sign off. That's okay.
All right. Thanks, Tim.
Thanks. All right. Bye-bye.
Supervisor Don Wagner, just to give you a brief background, because all great elected officials start off in education. Don served three terms on the South Orange County Community College Board, and 6 of those years he was president. After that, he spent 6 years as a state assemblyman, and then he was mayor of Irvine for 3 years. Last year, he won a special election to fill out the vacated term by Todd Spitzer when Todd became the district attorney. Don, thanks for being here today, and I'm going to turn it over to you.
Well, thank you very much, Jonathan and Lori. Good to see both of you and to be with the Rotarians. And you stole some of my thunder. I did get my start in education, and the board I was on, in fact, oversaw Irvine Valley College. So congratulations to Danny. He's off to a good start on his college career. That's obvious. So good to see. And in this time of COVID, it's great that some of the good stuff that we've been doing as a community all along is continuing. So let me take a second, and then I'll open it up to questions. But I guess I want to say right now, the news is good, though it's not all good. And by good news, I'll tell you that the Orange County situation is better than any of our surrounding counties in terms of COVID cases, COVID hospitalizations, COVID deaths. Per capita, we are way ahead of any of the surrounding counties. And our healthcare officials have come to us and said that it is possible for us to start easing up on some of our restrictions. What we've done in the county is come up with some guidelines that we are encouraging businesses to follow. If those guidelines are followed, then you're not going to see any action by the healthcare agency. You're not going to see any action by the sheriff's department. You still have to follow state and applicable city guidelines, but the County of Orange has its own set of guidelines in place that we think are, number one, common sense, and number two, will allow safely for businesses to reopen. Safe is key. Supervisor Steele and I were on an ad hoc committee that put these guidelines together. The way we did it was by making sure we had input from a very, very wide range of community interests, not just business, but healthcare providers in particular. We looked at what other states are doing in terms of guidelines for safe reopening, and essentially came up with a series of recommendations that if businesses follow, as we say, we think reopening can be done safely. No real surprises in any of it. It's things like using masks, physically distancing, increasing hand washing. If a customer or a client or whatever is using any tools or any workspace, that we increase the amount of sanitization that goes on. Those sorts of things are part of our guideline, and we are seeing an increasing number of businesses around Orange County starting to reopen. One thing I hear about all the time and want to make sure is clear is that the efforts at reopening have as a first, top, and maybe singular priority doing it safely. That's something that the governor and I have agreed on. He's done a couple of press conferences. He said this in one of them. We have it as a motivating factor in our guidelines, and that is this. We recognize that nobody is going to come out into our economy, shop, dine, whatever it might be that is part of economic activity, if they don't feel safe. Even going to the beaches, if you don't feel safe, you're not going to do it. The guidelines that have been approved universally that I've seen around the country that are now in place in Orange County require first and foremost that you do things to give your employees, your customers, your vendors, those who will interact with you, the feeling of safety. So that's where Orange County is at the moment. We are also working very closely with all of the surrounding counties other than LA, they've not signed on yet, to a bipartisan request of the governor that the governor not impose these one-size-fit-all rules that he has so far designated for all of California. What are those? Specifically, the problems that we've identified and that others in Southern California have identified are the metrics for one case in 10,000, no deaths within the last 14 days. Those sorts of requirements may very well work in sparsely populated communities and counties throughout the state of California. They don't work in Southern California. And more importantly, our health professionals tell us that those metrics are way too heavy-handed, that we can safely reopen, we can keep the curve flattening, we can continue to make progress and protect the most vulnerable amongst us without necessarily hitting those metrics proposed by the governor. Riverside, San Bernardino, San Diego, and Orange counties have collectively come together with our board leadership and try to engage the governor in negotiations, discussions, a fair give and take as to what would work in Orange County, what would work in Southern California versus what might work statewide. I am very optimistic that those efforts, because they are bipartisan, because they are not saying to the governor, you're wrong and we're going to ignore you, instead that we want to work with you, will bear some fruit. So we are just this week starting that process. I am hopeful that, as I say, it gains some traction with the governor's office. One thing I would warn folks about, if you are thinking about restarting your business or if you're thinking about participating in any economic activity, the governor continues to say to counties that go it alone or to businesses that go it alone, you may yet face punishment from the state. What would that look like? For counties, he's threatening to cut off emergency funding. And Orange County is already a donor county. We get 6 cents back for every dollar that we send off to Sacramento. That would be devastating for Orange County. He is saying to businesses that have state licenses, the obvious ones are alcohol beverage licenses, cosmetology licenses, the barbershops, the nail salons, but there are many others, that if you, and you can think of dentists and doctors, obviously, that if you open up too soon in violation of the state's guidelines, those licenses are in jeopardy. So that's one of the reasons we think a discussion, a robust and bipartisan fair discussion with the governor is very important. That's what we're pursuing at the county level right now. And as I say, it is not just Orange County, it is all of us locally in Southern California pushing for it. And the impetus, of course, is, as I say, Orange County is in very good shape in terms of deaths, hospitalizations, et cetera. One of the reasons we got into the shutdown in the first place, and this was federal as well as state as well as local, was to make certain that with a disease whose course was unknown, was novel, that's why they call it a novel coronavirus, and its effects were not entirely clear, and particularly worrisome, given some early projections, was to make sure our health system was not swamped. We are right now at a point where we have approximately 50% capacity in our hospitals. So we are to the point where we are nowhere close to overwhelming our medical system. Let me give you just one, maybe interesting to you, I don't know, metric to make that clear, and then I'll open it up to questions. About a month ago, I was the board liaison at our emergency operations center. We were still unsure of the course of this disease. We still are to a certain extent, but we were even less certain at the time. The discussion when I was there that day was, are we going to be able to use the Honda Center? Are we going to be able to use the Great Park Ice? Are we going to be able to use other ice facilities as temporary overflow morgues? That was a chilling, no pun intended, conversation. And that's what we were truly, truly facing a month or so ago. We are today somewhere shy of 80 deaths in Orange County. We are nowhere close to overwhelming our medical system. The goal of reopening is to do it in a smart, safe, structured way that assures we come nowhere close to overwhelming those medical systems. But the debate now is very, very different from, oh my word, are we going to have enough ICE facilities for our dead? Thank God what we did worked, and we aren't there yet. We don't expect ever to get there. And as we open this county back up, we're going to keep an eye to make sure we never get back there. So in a nutshell, that's where we are on COVID. I will take any questions about this or anything, but I know as well as you guys do, it's pretty much been all COVID all the time for the last 6 weeks or so. Questions?
In the Los Angeles Times this morning, it suggested that your health people were going to make a presentation to the board today and to receive the guidelines you're talking about. Is there a way that we can get a copy of those guidelines?
So let me clarify that. The guidelines I was talking about were guidelines that the board already put in place about 2.5 weeks ago. Board voted unanimously to put those in place. They are available on my website, on the county's website.
Right.
The guidelines that you read about today in the LA Times are, let's say, a little perplexing to me. And Carl, I'll tell you why. On Tuesday, the healthcare agency said they would be putting forth a plan for reopening. First I'd heard about it. So I asked the new director of the healthcare agency, what about this plan? And he said, well, it's not a plan. And then he used the word guidelines. And I said, okay, what about these guidelines? I didn't get any sort of the detailed answer. And then he started calling them plans again. So the bottom line is, the healthcare agency is coming forward with something today. I don't know if they're plans. I don't know if they're guidelines. I have had no input in the development of those. To my knowledge, none of my colleagues have had any input in the development of those. And they will come to us through administration. There is no board meeting scheduled today to review the plans. The next board meeting is scheduled for Tuesday. My expectation is that the document will be public well in advance of that, perhaps even today. I just have no idea even what's coming from the healthcare agency.
Okay.
I don't know whether to call them plans or guidelines. And I think I even said that to a reporter for the LA Times. I don't know whether it made it different.
No, I appreciate the answer. And so if we follow the guidelines that we already have, then that's what we should be doing.
I would urge you to follow those guidelines, but I will say, don't forget state and, in this case, city of Tustin guidelines, or whatever city you're doing business in, also still apply. And the governor has made it clear he's not shy about enforcing, despite what the counties are saying.
Right. Thank you.
Yeah, thank you.
Supervisor, my name is Bill Hartman, and I live in an apartment building in Orange. And in my apartment complex, and also in my friends' townhouse condominium projects, all the managers have shut down the pools, the swimming pools. And I was just wondering, was that a county order to do that? And if so, or do you have any input on how that might decision be reversed?
Good idea, good question. And the answer is that I have just today received word from our healthcare director, Dr. Quick, that she is reconsidering or reviewing and will issue new rules regarding pools. I don't have any idea, quite frankly, whether that's going to be part of the guidelines that was referred to in this LA Times article or not. Because as I say, I'm a little unclear what they plan to bring forward. But I do believe there is relief on the swimming pool front coming very soon. It's my understanding the disease is not transmitted by water. So hopefully there will be some efforts real soon, Bill, to get the pools back open.
Great. Thank you very much.
Okay.
Ellen?
In terms of safety, are you seeing an increase in crime with all the early release of prisoners and like the pedophiles?
I'm going to say not specifically. I'm going to tell you no, that the sheriff's department has not reported to us a great increase. What I will say is that maybe some of the reporting is a little overblown, whether the pedophiles are being released. By and large, those that are dangerous are remaining locked up. And you're also seeing, to be honest about it, lots less property crime because people are home. And so once we start opening back up and people end up going back out to work, maybe then is a good time to pay a little more attention to property crimes. But I will tell you, I am not hearing anecdotally, and certainly not with hard numbers from our sheriff, that there's been an explosion of crime. Maybe a little bit of an uptick, but fortunately not right now.
Question, Don, is there any way that the supervisors could lobby our TV channels to give the supervisors a couple of minutes to bring Orange County residents up to date, to stay in touch with Orange County? We get to listen to the mayor of Los Angeles, we get to listen to the governor, but there's not a good way of communicating what's going on in the county to county residents.
I would agree with you. There isn't, unfortunately, because we are part of the LA market, and our local stations have started closing down. That would be a normal vehicle for that. We do have a press conference. Actually, I think we have 2 press conferences a week. We do have our board meetings, which are all streamed online. I know I have done personally a number of LA station interviews and talked to them a number of times. But I will agree with you, as a poor stepchild of the LA media market, there is no question that it is harder for us to get our message out and be heard. And I'll add that's an impetus behind the 4 counties getting together, San Diego, Riverside, San Bernardino, and Orange, to magnify our voice, at least with the governor up in Sacramento, but also in the media as well. It's not all LA all the time.
Thank you. Other questions? Johnny?
You say Johnny?
Johnny.
Thank you. Hi, Don. Obviously, we're concerned about the reopening of not just schools, but the swim school industry. I've been working with a coalition of California swim schools, petitioning the governors to get consideration for reopening, hopefully in later part of stage 2. As far as the county, will the direction mostly be coming from HCA or the supervisors, or in conjunction with? And if so, do you think there might be some consideration given to the distinctive nature of the swim school business versus recreational pools, park and rec, home association pools, etc., where we have a very controlled environment where the children are working with the same teachers, very easy to track and trace if it was necessary. But just considering the unique nature of it, and I had a conversation with both Tara and Rachel from your office this morning, and extremely helpful. You've got a great team. I just appreciate all you're doing. But approaching it from the public safety standpoint of drowning prevention, and we've already seen tremendous spikes in Florida, Texas. There's been a 4-year-old girl drown in Northern California. The risk with the home isolation is sky high because of the increased exposure to bodies of water. Do you think there will be a pathway for consideration with our facet of the industry?
Let me say, Johnny, thank you. I know you sent some emails, and I've had a chance to look at them. I've talked to Rachel and Tara both about it. You identify a great issue, and so thank you for reaching out to us and being proactive. That word is now into Dr. Quick as I say, she's looking at easing some of those restrictions. Your concerns are valid and have been forwarded to them, to HCA and to Dr. Quick. I absolutely do believe that there will be, and there certainly should be, a consideration not just of swimming in general, but even if you don't want to go all the way towards opening all of the public pools, at least you make a great compelling case for why we ought to at least treat the swim schools differently. So that's a long way of saying help is on the way.
Yeah.
To you, I also think, though, it'll be even broader than to the swim schools. The relief ultimately will come from, I guess it's may technically end up coming from the Board of Supervisors, but it will be following the advice from Dr. Quick. We've tried very diligently, because none of us are doctors, to not get out in front of where the medicine and the science take us. She tells us, at least as I understand it, it's taking us towards a reopening of the swim schools, the pools, etc. And so we'll be following her guidance on that. But I will assure you the issues you've raised have in fact found their way to her, because you're speaking for an industry that needs somebody to speak for it.
Thank you, Don. Appreciate that.
Gary?
Yeah. So, Don, I wanted to, thank you for coming on here and giving us some information that we haven't had before. Because we do, like Dick was saying, we kind of have a lack of information. The media that we hear every day is either national or regional or it's LA, and it doesn't really pertain to us. So really, my question is right now is what stages, what are the stages, and what can be reopened now and be reopened next? We were out at the park the other day, and all the parking lots for the parks are all blocked. So what are the stages, and when do you think that they're going to be available?
Gary, great question. And the stages are sort of something the governor has come up with that I suspect he's got people advising him. I don't know, but the governor has kind of said stages. And stage 1 was pretty much everything shut down except essential businesses. Stage 2 is to reopen some of the essential businesses and the parks and the beaches. Stage 3 is where you get to some of the more personal intents, like the salons, the hair cutting, etc. And then stage 4 is the mass gatherings, the concert venues, the sporting venues, etc. That's in a nutshell the way the governor has outlined it. We are trying to just be, I suppose, a little less draconian and rigid in terms of these stages, and say, if you can safely do this, do it. If you can't safely do it, don't. And let's figure a way for you to safely do things. And that's the gist of the guidelines that we've come up with. In terms of a timeline, I got to say that really depends on who you talk to, and it's been a moving target. Two quick examples. LA just yesterday or the day before, I think it was the day before, said that notwithstanding their current order and its expiration date, they're going to extend into August. Now, I think we're going to be able in Orange County to be sufficiently farther along than that by the end of May. God, I hope so. And as long as we can do it safely, there's no reason to wait. The governor has also kind of been a bit of a moving target. The day he announced the closure of the beaches in Orange County and Orange County alone, he said, don't worry, we are only weeks away from moving to the next stage. The very next day, he said, forget it, we're only days away from moving to the very next stage. And then in his very next news conference, he said, we'll have you open by the end of the week. So I'm not going to hazard a guess as to when. I just can tell you we are pushing for as soon as safe as possible. And if we're able to open the Honda Center for mass gatherings and do it safely before LA is comfortable opening the Staples Center, then that's a decision that the locals are better able to make than are for us. And I wouldn't second guess LA. Better for LA to make for itself, better for Orange County to make for itself, rather than be made one size fits all from the governor.
So don't you think it's that it makes sense for business owners to make that decision? I mean,
I do.
Yeah.
I absolutely do. Look, I trust you to make the decision that is right for yourselves, your employees, your customers, and that's why Orange County has in place the guidelines that it has in place, because you can make those decisions and you can do them safely. And if you are not doing them safely, your customers are going to tell you. You don't need me to tell you. The problem is that the governor has made it clear the state law continues to apply. As a matter of law, he's right, it does. And he has leverage. Those licenses, though he can send the CHP. If he wants, he can call out the militia and use them. I don't think he goes that far, but that threat remains out there. And I urge caution for any business that wants to reopen. But, you know, yes, to my mind, it is a decision better made by the individuals than it is by the heavy hand of government, be it in Orange County or be it in Sacramento.
Other questions?
So to clarify, if we get the go ahead, because the health department is the main person, you know, entity that we're worried about at the swim school. So if they say go ahead, we're fairly safe, but we're still at risk of Newsom coming down.
Yes, state law continues to apply, as does, you're in Tustin, your school's in Tustin, does any Tustin order.
Right.
I do know Tustin is moving in the right direction. I think they recently reopened their parks. Oh, somebody asked me about parks. I think Tustin recently reopened their parks, but check that yourselves. I don't want to speak for them. We did in Orange County, just at our last board meeting Tuesday, give directions to reopen the parking at all of our county parks. And we had actually never closed the county parks. We had closed the parking. Couple of reasons for that, but the parks themselves remained open. They are still open and effective almost immediately. It may even be in place starting today. If not today, it'll certainly be by the weekend. The parking lots in the regional parks are open again. And so use our parks by all means.
The parking lots in Tustin are open again.
Are they good?
At least the one closest to us, we drive by it and it's the barriers are down and people are parking in there, so they're being used.
Right.
I think so.
Other questions?
Good question. Don, other than COVID-19, what worries you every night about what's going on?
Well, Jonathan, the thing that keeps me up at night is obviously you don't want to open in the wrong way. You don't want to open too soon without enough protections in place, both to keep people safe now and to stop a recurrence or I mean, at some point, and I've heard this from a number of medical professionals, there is serious concern that absent herd immunity, which we may not have because of the shutdown, we could see a resurgence in the fall. And so we need to be ready that if that happens, we don't overwhelm our healthcare system, and to the extent possible, make sure that doesn't happen, or that it is as shallow an impact as we've, thank God, had so far. That worries me. Beyond that, the thing that worries me as much as anything else is the long-term damage we are doing to our municipal governance and to our schools, which is of course important to everybody on this call, but obviously to you, Jonathan, on the school board. And the truth is that with the downturn in the economy, with the explosion of unemployment, with the businesses going out of business that we're seeing, you're going to see a whole lot less sales tax that supports the municipalities, a whole lot less income tax that supports ultimately the schools as it comes through Sacramento. We are in for a very long, slow recovery back to normal. And I was on a call with an economist who I respect greatly about a month ago, and he was saying it's going to be this V-shaped dip. We're going to just dive, and then everything's going to be fine, and we're going to rise back up quickly. And increasingly, I thought that was optimistic, overly so. And increasingly, we are seeing the recovery will be, speaking of flatter, much flatter. And that has enormous long-term implications for the health of our economies. And that worries me greatly.
Don, something else that came out, there was in the newspapers recently about the Orange County taking a hit for the lack of testing. Where do you see us going? Because you hear the things all the way from it should be 100% testing to everything from there down to zero.
Testing has been a frustration of mine, in part because the county has been behind our surrounding neighbors in terms of just the amount of testing that is available. But it's also been a frustration, and by the way, and that problem is rapidly being fixed. I'll talk about that in just a second. But you know, the flip side of it is that the idea of wholesale testing is great for the epidemiologists. It's great for the folks that are studying the disease, but it tells you practically nothing about what to do as a policymaker or what to do as, say, our public health official, Dr. Quick, what she should advise the policymakers to do. You can get tested today and come up with a disease tomorrow. You can get tested and have the antibody, meaning you maybe had the disease a while ago, it didn't affect you greatly, but you're perhaps, we don't know the science, still susceptible to it. Testing, to my mind, should not be the be all, the end all to make decisions about next steps in dealing with the pandemic. So I do worry that testing has been sort of a focus that actually doesn't help us. The doctors will tell you, our doctor will tell us, you test somebody, that doesn't tell you what you ought to do with that person. If they test positive, but they're feeling fine, isolate. If they test positive and they can't breathe, hospitalization. And you're going to know that somebody can't breathe and needs to go into a hospital, whether they're tested or not. So the focus on testing, even I understand from our doctors, is less helpful in what do we do today to get past COVID than it is long-term understanding of the disease, as important as that is. Okay. That's a long way of saying that's kind of philosophically where we are on tests. Here's what, and it surprised me, we heard from HCA on Tuesday at our board meeting. We can do in this county, between the serology tests and I guess the nose swab tests, up to 9,000 tests per day. The day before our board meeting, we had 303 tests done. So we've got plenty of capacity. The reason we didn't have very many tests done in part is because doctors are saying, I don't need to prescribe tests. You're not feeling well, isolate. You've got serious complications, hospitalize. I don't need the serology test, for example. So the tests are out there, they are available, they're not being utilized to the extent the public may want. We are continuing to try to get more of the swabs because they are more precise, I believe. Some of the serology tests haven't been approved by the FDA. Some of the serology tests have a higher false negative or false positive than others. So testing is sort of a moving target and not, to my mind, the answer to everything COVID related.
No, but what do the doctors or the medical team say about testing people, the asymptomatic people who are carrying the disease and are potential to contaminate people without them even realizing they're showing no symptoms, but they still carry, still a carrier and can still infect people?
Right. Until you test 100% of the population, you're not going to know 100% of the asymptomatic folks. And what the doctors are saying to us is that there are, given the limited universe of tests that are close to 100% accurate, there are hot spots, for lack of a better word, that are the places we really ought to focus on. And no surprise what they are: nursing homes and places where there's congregate living, most importantly, the jails. And the sense is that if we were to focus on those places, which are a significant percentage of our cases countywide, we would be very, very much farther ahead in isolating where we ought to direct our resources. Quick point on kind of related to that. In Orange County, 85% of our cases are in the demographic 55 and over. So, and the bulk of those are above 65. So we know the populations that are most at risk and most needing of tests. It's that demographic, it is the nursing homes, and our medical professionals are saying to us, let's go where we know the disease is, try to get a handle on it before we're scaring everybody out there. There's 3.2 million of us into getting tests. At least that's where they say the disease is currently for us.
Well, I think one statistic that would be useful is, particularly in areas where have done a lot of testing, is what's the percentage of people tested who are asymptomatic? I mean, if it's a half of 1%, then that's really a minority, very, very minority population. But in fact, they're finding that 10% of the people that they're testing are asymptomatic. Yeah. That may be a little more concern.
Agreed. No, I mean, I agree. As I say, I'm not saying there's no role for testing. What I'm saying is that the testing is great for the epidemiologists to learn more about the disease and how best to treat it. In terms of us making our decisions today, it strikes me as unwise and an unnecessary delay that we have X percentage of the population tested before we can open up. Depends on what that X is. And we're hearing that from our doctors. Again, I'm not a doctor. I don't want to get out in front of the science of this.
Supervisor, kind of a follow-up to that question of testing is in many European countries and even in the United States that testing of wastewater can show disease and even drug use in a community. Is the county looking into that way of testing the broad population by testing wastewater to detect the COVID?
I am unaware of that. I can raise the question. That's an interesting one. I don't know.
James, you had a question? James Haas?
James Conner.
Oh, James Conaway, I'm sorry. James Conaway, you have a question?
No.
Okay, all right.
I have one.
Fred has one.
Fred?
Yeah. I understand that you might be moving into the North Tustin area, and I'd like to invite you to join our Tustin-SantaAna Rotary.
Well, I am absolutely unaware of how you got that information, but it is not yet a done deal, but we've identified a property.
Yes, I know.
In North Tustin, you bet.
Yes, on Hunting Horn.
Exactly. Exactly.
Travels fast on this street.
Come see me. I got to meet a contractor out there this evening.
We'd like you to become a member of our Rotary, and if you can't make the meetings, perhaps a staff member could make the meetings.
I appreciate the invitation, but you got to get a better backdrop. You're up in Northern California.
Okay,
I've heard Don say before that if he, that his favorite place other than after Irvine is Tustin.
Yeah, we've got an offer out on a house in North Tustin.
Okay, well, good luck on that. And
thank you.
Are there any other questions for our supervisor?
I have one other question.
Okay, Gary.
So, so we talked about the tests being available, and I've heard that even the president and various people say tests are available to anybody who wants a test. Is that actually true in Orange County, or is it just like the same process? And the other question I have that's related to that is when somebody thinks they need to have a test, where do they go, and what does it cost, or is that they just go through the normal channels?
Yeah, the questions may actually have a somewhat related answer. I've heard that you want a test, come get a test. And I have heard that we've got 9,000 tests available per day and nowhere close to that number of people taking us up on it. So I would say you would think tests would be available if you need one. But I'm also hearing from constituents that, well, you still need a doctor prescription. That may be for the swab, not just for the drive-up finger prick tests. So it may depend on the type of test that you want. But I will admit that is a bit of a moving target for me, a little bit unclear. And as I say, it may depend on the type of test you want. The other thing that you probably ought to factor in is that to be honest, that 9,000 number is what's also available through the private physicians, some of the hospital networks as well. I know my wife's physician says, we'll test anybody. I believe they've said that. Otherwise, you've got to be in that. It isn't entirely just as simple as I would like it to be, but there absolutely is excess capacity out there. Where can you find those tests? Again, the county's website, the healthcare agency's website has got a very comprehensive list of available testing centers. So what I would suggest you do, find a local one, call them, see what the requirements will be if it isn't online for you. Tests are available. There are 9,000 of them a day, but it is true that not everybody can go anywhere and get any test done they want. Yeah.
You might check with your doctor. Ellen and I checked with ours, and we were tested earlier in the week and got the results the next day from his office.
Yeah.
And happy to say that we're clear, but So check with the doctor that your local doctor may be able just to take care of it for you.
Of course, you were clear that day. You may not be clear today.
Yeah, right. I was clear then, but all bets are off now.
Yeah. So I had to go to the doctor's office a couple of days ago to get a blood test. I actually met with the doctor online. It wasn't Zoom, but it was online meeting. And then he said, well, you need to come in and get a blood test. I went there, and there must have been 20 healthcare workers at the doctor's office that, you know, in their masks and outfits and the face shields and all that stuff. And there was 2 of us in the building that were there to get blood tests. But it seems to me that we've shut out people getting normal health care to make allowances for all the people that they're expecting to have with COVID-19, but that's never materialized. And as a result, we now have a way excess capacity of people for regular health care that is not being used, and people that had these other ailments that they want to see their doctor for are not able to do that now.
Well, just as a sign of things changing, our son-in-law went in and saw the doctor the other day, and he's being set up for hip replacement surgery. So there are some doctors who are now beginning to do surgeries that over the past couple of months have not been allowed because of the anticipated overload in the hospitals due to the coronavirus.
They just opened up the last couple of weeks.
Fred,
The hospitals
recording showing the time.
for non-essential.
Back to that beach.
Okay, we've taken too much of your time.
All right.
Yeah, so we should say thank you.
Okay, I'd like to thank you, Don, for being here, sharing with us all these things. And we're going to continue our series next week. In fact, we have someone from the testing community who's going to be talking to us about testing and her experience in the world of testing, what's going on now and what we might be looking forward to in the future. So we would like to encourage all of you to join us for that. I would like to thank Lane for being with us here today. And Carlo, I'm glad you were able to join us today and find us on Zoom, and we look forward to seeing you back again. And we all look forward to getting together in real time sometime in the near future, but in the future for sure. With that, I'd like to say thank you. And again, thank you, Don. And we are officially adjourned.
Thank you. Bye.
Thank you, Don.
Thank you, Don.
Thanks.
You may get a call from Anaheim.
See you later, guys.
Carlo, tell Lily I said hello.
I'll let her know, Jonathan.
Thanks.
See you.
See you again next week.
See you again.